Welcome, everyone. Welcome. We are crowding the winner's circle here because this is a huge day. And if you had anything to do with our smoking ordinance, will you please join us up here? Don't be shy. We want everybody who had anything to do with this. So I would first like to, I have a couple different sets of council members up here. So right near me are Bill Segelka, former council member from the 7th District, Jock Wigginton, former council member from the 2nd District, and they, as well as I, were on the council 20 years ago who passed the smoking ordinance. And then we also have a lot of our current council members, and when I say your name, will you kind of do that? Vice Mayor Dan Wu is with us, Council Member James Brown, Council Member Chuck Ellinger, Councilmember Hannah Legree, Councilmember Liz Sheehan, Councilmember Denise Gray, Councilmember Whitney Baxter, Councilmember Dave Savigny, Councilmember Jennifer Reynolds, and Councilmember Kathy Ploman. Did I miss anyone? And I apologize. Councilmember Ellinger was also on the council at the time we passed the smoking ordinance. He did recuse. So anyway, with me today are Dr. Ellen Hahn, Professor and Director of Breathe at the University of Kentucky College of Nursing. We have Dr. Lee T. Todd, former UK President. And today we are celebrating the 20th anniversary of Lexington's historic ordinance prohibiting indoor smoking in public places. We remember the date, July the 1st, 2003, when we passed this ordinance. This is a big deal. Lexington, yes. Lexington's ordinance has had an enormous impact on the health of Lexington's citizens as well as those who visit Lexington. In terms of public health, it is one of the most important, if not the most important, ordinances we have passed in the last 20 years. It has saved countless lives. Back in 2003 and continuing today, the goal of this work has been to give people access to clean air and a healthy environment. The work started with Dr. Ellen Hahn, a group of concerned citizens. Dr. John Poundstone, our Fayette County Commissioner of Health, and Kevin Hall is here from the Health Department somewhere. There he is. Several council members, including me. And in 2013, we transitioned to this group, Breathe, which I currently chair. I wanted to shout out a few people who I think are here tonight who've been such an important part in this work over the years. So please raise your hands when I call your name. And you know, this first group, this was very controversial with bars and restaurants. That's putting it lightly, probably. Restaurateurs Jim and Molly Sawyer are here. There you are. Rob Ramsey. There's Rob. Okay. And I don't know if Joe Bologna was able to stay.
Said he'd get back to work.
Okay. They were supportive from the beginning, and they were in the middle of a huge group of restaurants who were not supportive. So I cannot thank them enough. So current and former Breathe board members are here. Dr. Tim Mullett, Medical Director at Markey Cancer Center Network Development. Where are you, Tim? Back here. Yes. Former Georgetown Mayor Ed Varney. Whoa. So Mayor Varney at the time put his whole self into this and became the second smoking ordinance in Kentucky. Bob Babbage, who helped us in the legislature. Ellen Cartmel, are you here? Where are you?
Right there.
Well, you should be up here. Tobacco Prevention and Secession Program Manager. Amanda Bucher, Director, Tobacco Policy Research and Outreach at UK. Amanda?
Behind the camera.
Oh, okay, back there. These are really just a handful of the folks who worked so hard for so long to make this happen and to help the council understand the facts, the data, and why we should do this. Most of these people remember just what a battle it was to pass this ordinance. Many business owners felt their customers would disappear, and we were going to put them out of business. Remember those words? And the ordinance was challenged in court and eventually upheld by the Kentucky Supreme Court. J.D. Cheney, Executive Director of the Kentucky League of Cities, couldn't be with us tonight. He described this case as the most important case in local control history. After Lexington's smoke-free law took effect, there was a reduction in heart attacks and emergency department visits for asthma, and the smoking rate in Fayette County declined nearly 32%. This ordinance paved the way for the University of Kentucky, Dr. Todd, to adopt a tobacco-free campus to protect the health of students, employees, and visitors. First tonight, I want you to hear from the woman who kind of started it all, right? Dr. Ellen Hahn. Ellen, I know you'll have some things to add to this and maybe some stories to tell. Welcome.
Whatever.
Oops. Hello, everyone. I'm really happy to be here tonight. I can't believe it's been 20 years, but if you'll indulge me for a minute, 23 years ago, Lexington Health United, I don't know if anybody remembers them, but Lexington Health United was a small group of health and civic leaders that got together, and they wanted to do something good for the city. And most of all, it was the hospitals, the healthcare systems. And so they invited 2 tobacco control experts, I happen to be one of them, to come talk to them about the best way to lower tobacco use in Lexington. So I was honored to be one of those who recommended Lexington pursue an ordinance to prohibit smoking inside public buildings. I kind of thought they'd laugh us out of the room, but they didn't, and they asked if we would help them pull together a plan to do so. So over a 3-year period leading to the passage of this law, there were several key events that I just want to mention because some of you probably don't know this was happening behind the scenes. First, we held a community education event, and about 100 people from around the state came. And at that time, Councilman at large, I believe, David Stevens, I think he was at large at the time, good, I was right. So we invited national experts to speak on the known health hazards of secondhand smoke. And what we learned was, guess what? The debate was over, the science was clear, 20 years ago even, that secondhand smoke causes disease and premature death. Then, Vice Mayor Isabel Yates, at the time, appointed a task force to study whether Lexington should enact a smoke-free ordinance. I happened to be appointed to that task force, and so was Lisa Maggio. And we were asked to study whether Lexington should enact a smoke-free ordinance. And so the task force actually agreed that secondhand smoke was a health hazard and that a smoke-free ordinance would not not harm our tobacco farmers, because that was a big deal. We had to talk about that. We did have people from the College of Ag and tobacco farmers on that group, but we all agreed that it wouldn't hurt the farmers, that it was a health problem, and that the council should consider an ordinance. So, the work of the task force prompted a small group of passionate health advocates, most of them who are right behind me today. I'm going to say their names. They formed Bluegrass Action, a coalition to give voice to workers who deserve to breathe clean indoor air. Yvette Hurt, raise your hand. Oh, she had to leave. She was here before. Yvette Hurt, Lisa Maggio, Beth Overman, Carol Riker, right here, Kathy Tabb, and myself supported each other. It was hard. And there were many crying fests, as you can imagine, as we were trying to talk to our elected officials. And some of them, weren't sure they wanted to talk to us. And some of them didn't talk to us, but they wrote it the right way. So anyway, we educated the council to the value of smoke-free laws. And we did cite the research, because at that time, 20 years ago, there were states in this country that had already done it. Full states had done it. Ohio had done it. California had done it. But really nobody in the Midwest, actually, no, Ohio had not done it yet. There were no places in the Midwest or the South that had smoke-free ordinances at the time. So anyway, the Lexington Health Department was key, and I know Casey Allen Bryant is here, and she, I believe, was on the Board of Health at the time, or almost on the Board of Health at the time, and of course John Poundstone, who was that you mentioned, was the director. But really every step of the way they were there to support us as a coalition. And there were so many others, adults and youth, really too many to name, who showed up at the council meetings, the community events, talked to their council members over coffee, their neighbors, wrote letters to the editor, called into the radio talk shows. I understand Cruiser was talking about this today, which is amazing, 20 years ago. The ordinance wound its way through the service committee. It was a subject of multiple meetings. The public was engaged in a lively debate. Some were for, some were against, but at the end of the day, the ordinance that was originally designed by David Stevens to be restaurants only covered all restaurants, bars, and public buildings open to the public. And the law, I might say later, was strengthened by the council to include all workplaces and electronic cigarettes, the use of electronic cigarettes or vapes. So, as with all tobacco control laws, though, the tobacco industry often works behind the scenes to derail the policies, and Lexington's law was no different. The mayor mentioned that the industry sued the city, sued the health department to stop the law from taking effect, and it did. It was not in effect in September as planned. It went the whole way to the Supreme Court, and it was upheld. The Supreme Court upheld our law in April 2004, and they said not only is it the right of local government, but it's the responsibility of local government to protect our citizens. So that was really cool. But let me just say, Phil Scott and his colleagues, Phil couldn't be here today with us, but with funding from the local health department, quite a bit of money from the local health department, brilliantly defended our ordinance through the court system, and for that we are forever grateful. So I want to end my remarks, though, with since then, 58 other Kentucky communities have passed smoke-free ordinances because of Lexington. Most of them are strong laws, like our law, covering all workplaces, public places, bars, restaurants, etc. And we now protect 38.2% of Kentuckians. We have work to do, but we have published 17 research papers over the past 20 years. It kind of makes my head spin that there's that many. And all of those papers looked at the impact of Lexington's law and the other laws in Kentucky, and not only showing health improvements and money saved in Lexington, but also showing how strong smoke-free laws throughout Kentucky, those that protect all workers, no exceptions, have lowered hospitalizations for people with emphysema or COPD. They've reduced new cases of lung cancer. Let me say that again. So if you live in a place like Lexington, we have fewer newly diagnosed cases of lung cancer every year. Yeah, that's pretty awesome, right? We have fewer preterm births. You know, and preterm births cost a lot of money to take care of these little tiny babies. So we have fewer preterm births in places with comprehensive smoke-free laws like Lexington's, and we have fewer youth smokers. So fewer kids start smoking, and fewer kids even use smokeless tobaccos. So we know the benefit of these laws. Clearly, the dose matters, though. The strength of the law matters. So we have found that strong smoke-free laws actually save lives, save money, and all of our economic studies, probably I think there's 7 of the 17 are economic studies, have found that business is not harmed when these laws are passed. So, in conclusion, as we celebrate 20 years of smoke-free air, please join me in thanking Mayor Gordon and all the council members for their pro-health leadership. I just want to say, you have saved countless lives. You have saved millions of dollars in health care costs. Thank you. Taxpayers, I pay my taxes. And you've saved me money. Thank you. You've also left an enduring legacy for all who live here, who work here, and who visit here, Lexington, Fayette County. So thank you.
Thank you, Ellen.
Yeah.
Thank you so much, Dr. Hahn. And I'd like to ask Dr. Todd to come to the podium. He was the president of the University of Kentucky and took them smoke-free. Come on, Dr. Todd.
Well, thank you, Mayor, for allowing me to participate in this awesome event. I have to admit, I was a new president at the time dealing with things like football probation and budget cuts, and didn't realize the angst that you went through. I kept reading the paper and had such admiration. I lost my mother at 56 years old from lung cancer. And so I thought, this is great. I hope they can pull it off. What really impressed me, though, is I read all those articles. I saw this Ellen Hahn name keep popping up. And she came to me after this ordinance was passed, and it truly did make it possible for us to move this through quite smoothly. I'm almost ashamed to say I had very little problems at UK. We had a board chairman who was a farmer, and we got a national award for being the first major university in America to go smoke-free. When I went out to receive that award, which was due to Ellen's effort, the people that were there said, we could never get this through our board of trustees. How did you do this? And it really was, I think, lubricated by the efforts that were made by the restaurants here that are represented and by the city. And it was the right thing to do. Ellen came to me with the data. You know, when you try to solve a problem, you got to have an instigator and an initiator, and it's great if they have data and not just spirit. And then you got to have leadership, but then you have to have execution. You got to make it work, because one thing to talk about it. And probably the most memorable thing I ever said when I was president was about the Kentucky Uglies. I was in my first month in office. I went to the Rural Health Center in Hazard, and got off on the elevator, and there was a bulletin board full of statistics of Kentuckians with obesity, lung cancer, spina bifida, on down the line. I said, damn, this is ugly. I spoke to the community that afternoon, and that's the first place I made the comment. I said, I'm a native Kentuckian. I know about all this stuff. We've grown up with it, knowing about it. We just don't talk about it enough. And if you don't talk about a problem and visualize a problem, you don't solve a problem. And so we really need to get out there and make this a visible thing that we need to execute against. Well, Ellen gave me the data. The Board of Trustees gave very little pushback. I was surprised. We put it in the hospital first. One thing you have to understand, a lot of people in our hospital who were told that they couldn't smoke were visitors who were there to see their loved ones, and that was pretty challenging. That was probably where we got most of the pushback. I still remember the people with their IV poles standing out on the sidewalk smoking cigarettes. We tried to get control of the sidewalks, but we couldn't get that, so we had to put up with that for a while. The thing about execution, and to say, an academic institution can make some appeals and make some statements, but if it's all just paperwork, that's not going to make it. But Ellen and Anthony Beatty chaired that committee with you. They found student ambassadors who would go out and approach students and anybody who was smoking a cigarette outside a building on campus, and they were actually training them in a non-confrontational way to explain to them this is kind of not supposed to happen. She had another group that would actually go around campus and find out where the cigarette butts were around the campus, so they know to stalk it out there and catch these people. And so that's the level of execution that you have to have. And so I'm really proud to be a part of this. And again, I was on the Breathe Committee. This mayor not only is mayor, but she chairs that Breathe Committee. She was on there as a member, as was Mayor Varney as well, Tim Mullett as well. And this is continuing. It's a persistent problem. When I gave my inaugural speech, I wanted to put the Kentucky Uglies in there. My PR people said, why don't we call it the persistent problems of Kentucky? It just doesn't roll off your tongue, But we kept after that. And I want to applaud President Eli Capilouto for keeping this vision going on smoke-free, but also setting up facilities to attack the problems, these things that Kentuckians need to fix, because if we fix our health and fix our education, we'll have a different state and a better state. So congratulations to everybody here who had the courage to do what you've done. Let's keep it up and make Kentucky a better place. Thank you. Thank you.
Thank you to all of you, and I'm just so proud of everyone who has been involved over the years with this effort. We have left a public health legacy for our city's workers and residents, and I thank all of you for being here. I know a lot of these folks will probably talk with the media if you ask. So thank you for being here, and feel free to ask questions. Thank you.